So what are usually signs and symptoms? And for this talk, we're only going to focus on lung neuroendocrine tumors, which are the well-differentiated types of tumors, typical carcinoid, atypical carcinoids, and so on and so forth. And we'll go through some of these details further as well. So, talking about signs and symptoms, the most common is the pulmonary symptoms because the cancer is arising from the lung region. So, cough and wheezing. There can also be some shortness of breath, some dyspnea. Usually, this kind of cancers, which are neuroendocrine tumors, they also produce hormones. And that's why they can have some syndrome called carcinoid syndrome. It can lead to diarrhea, shortness of breath, which is dyspnea, flushing. You feel like red hotness as if you've gone out in a in very heavy sun in a summertime, and suddenly you're having flushing. So those kind of symptoms. It can also lead to carcinoid heart disease, which is usually right-sided valve disease, and it can lead to fibrosis of the valve, and it can lead to symptoms which are similar to heart failure, which means there can be swelling in your legs. It can again have symptoms of breathing difficulties, dyspnea, and such other heart-related symptoms. Cushing syndrome, which literally means high cortisol in the body, and that can lead to similar symptoms as if you're having high steroid level in your body as well. First and foremost, it can lead to gigantism. Suddenly, you see that at the age of 40 or 50, your body is starting to grow and you're having changes in your facial features, you're having changes in your, especially hands, legs. You're thinking that you're having your bones grow a little bit. And those kind of symptoms are secondary to Cushing syndrome, which are high steroid level, secondary to gigantism. And certainly, when this cancer metastasizes to other sites in the body, it can lead to symptoms and signs for wherever the metastasis has gone as well. Very, very, very often, these lung neuroendocrine tumors might not have any symptoms. And that's why it is extremely important to do lung cancer screening. I'll quickly plug in some more information about lung cancer screening over here. Based on current guidelines, if you are between 50 to 80, and this age criteria are evolving based on insurances as well. But overall, if you're between age 50 to 80, you are a current smoker or quit within last 15 years, and you have a 20 pack year smoking history, which means that you have smoked for 20 years one pack, or you have smoked two packs for 10 years, that still falls into the same criteria. You can go for lung cancer screening, which is a low dose CT scan, and it will help to identify if there are any lesions, any nodules within your lung. And usually, this kind of lung nets are identified when the CT scans are done, because the radiologist will find that there is some abnormality which doesn't look purely like a big cancer, but could be around like 1.2 centimeter, 1.3 centimeter, and they will tell you, or they will tell your primary care doctor that, hey, please send this patient for biopsy, and that's where these diseases would be found. That's why very important to get lung cancer screening.